Another one is very similar because we could see on the animals. If we looked at the different groups of the animals, they looked completely differently. The nice group that we had about the 135, they looked nice, almost same as a control. And we looked at another one, they were, let's see, a little sick shaped animals. So they, let's see, they starved, they looked like, because what they did, they ate a lot and pissed a lot. Because the glucose, the energy, usually what they intaken, it's pissed out immediately. But these animals somehow, if you are looking at, this is the control. So only this 4 weeks period, only they didn't gain any weight. But when we induce, let's see, we use different dose of the deuterium. As you see here, for example, this is a control with a squared. And this is the 135. So it looks like the gain of the weight is correlated very well with the glucose utilization. So these animals, whoever received a little bit less deuterium, somehow they utilized the glucose more efficiently, and this way they incorporated into the body. This is why they gained weight. Now when we looked at, let's see, the food intake, because they're very important, how much food they ingest. If they ingested the food and pissed out, they always eat it and drink it. That was the animals, what a diabetic animal does. As you see here, it again has an optimum. Here, the tap water, of course, they ingested a lot of food, but when we decrease the deuterium content, they need less food and they gain much more weight. So this way, they utilize more efficiently the food or they digest it. Another one very important one, the drinking water. Of course, this high glucose concentration will cause osmotic diuresis. This is why the glucose is taking the water out. This is why the diabetic patient should drink. Like these animals drink a lot. If you look at normally, a rat drinks about 30 ml per water per day. Now these animals had about almost 300 ml per day, so about 10 times more. Now, that's very good, for example, in this point of view, not for Gabor, because he had to supply a lot of water to us, but it means these animals, let's see, turned around the water content. What we have, let's see, about 60% of the water that we do have, so a 70 kilograms person has about 42 kilograms of water, and we cannot drink this amount of water per day, of course, but this animal had about the same as their weight. So had the same drink, about 300 ml, 300 grams per day. So that's about the same. So for sure, it takes about 1 or several days, and they exchanged completely, let's say, the water content of the body. So, but from this view, we said, okay, we do have an optimum, and very similar optimum what the glucose concentration showed. This value, let's see, this is how the insulinic affected on this body. What we did in this experiment, we gathered several animals from the several groups, and we ingested insulin to this rat, and we checked how the blood glucose level changed in this animal. As you see here, those animals who was treated, let's see, this is 125, 135, this insulin affected the blood glucose level is more efficiently, so the changes is much higher, comparing to the tap water or the less DDW containing tap water. So what can be the cause? There's two possibilities. One, the elimination of the insulin is different in different animals. Maybe the DD or the deuterium interfere with the insulin metabolism, the insulin catabolism. So for this, we are checked how the insulin disappears from the bloodstream. What we did, again, we collected several animals from different groups, and we ingested the insulin, and we measured the insulin level in the serum. And what we got, we checked for 12 hours. As you see, that doesn't matter which group that we obtained the animals, but the insulin concentration in the blood changed similarly. So there is no different effect, let's see, on the metabolism of the insulin. So we cannot say that this animal, whoever received the same amount of insulin, let's see, the insulin catabolized less efficiently. This is why the insulin could affect, let's see, longer time of the body. So there's no difference. Another one, let's see the insulin effect. Maybe the insulin or the post-receptor insulin effect is altered. For this one, we checked the translocation of the GLUT4 protein. The GLUT4 protein is important to take, let's see, the glucose into the body. Several tissues, several organs using this kind of transport system. We do have an insulin-dependent or non-insulin-dependent transport system, but the GLUT4 is an insulin-dependent one. So we do need insulin to activate this transport system. Unless we start exercise, because exercise can induce somehow this translocation in an unknown mechanism. So we checked how the GLUT4 translocation changed in these different animals, differently treated animals. As you see here, this is the tap water. And when we started to, let's see, alter the deuterium content of the drinking water, the translocation of this protein increased to the membrane fraction, meaning that insulin, let's see, induced this both to the, let's see, the membrane that can uptake the glucose and, let's see, can take the glucose up to the cell and can be utilized. These are the spots, the representative spots for the different kits. You can see some darker spots, meaning that there are more protein in the membrane induced by this insulinic effect. And this is the control animals. Doesn't matter whether we treat it with 25 or 100. These are not diabetic animals. This is a control animals that they are obtaining the glucose content. Almost we got back almost the same data talking about the GLUT4 transport system. So let's summarize what we got. First of all, of course, we could induce diabetes. This is not a big deal. Another one, however, if we start to lower the deuterium content of the water, that interfere with the insulin-induced, let's see, glucose utilization. That's very good, so some mechanism. Now, this deuterium did not influence, let's see, the elimination of the insulin, but it's influenced the GLUT4 protein system, the transport expression of this protein system. Now, let's see the conclusion. What can we conclude out of this data? First of all, this is for sure that this depletion, deuterium depletion, can enhance the GLUT4 translocation induced by insulin. Now, what can be the mechanism? First of all, we couldn't have any idea, and after we searched in the literature, because the Spanish wax we shouldn't figure out. And very interesting, about 20 or 30 years ago, they used deuterium to stabilize the microtubules intracellularly. These microtubules, especially, they are trafficking the intracellular signaling. And they use deuterium to somehow to conserve or fix this kind of machinery. Now, this is a hypothesis only. I haven't tested anything. But if we decrease the deuterium content, relatively more and more chance that this intracellular transporting system working more efficiently. So that's much easier to, let's see, take a protein out to the membrane or take the signal into the nucleus or into the cytoplasm. So this can be, let's say, some hypothesis, but we have to do some other work to clarify whether it's true or not. But one thing that somehow is affecting the insulinic effect. Thank you very much. That's it.
Thank you very much. So the presentation is open for discussion. Is there any question, remarks? That's it.
So